In this Xtalks interview, we're speaking with Dr. Rebekah Angove, Executive Vice President of Research and Evaluation at the Patient Advocate Foundation. Dr. Angove is an experienced nonprofit executive and leader in patient experience and engagement. Listen on to hear about engaging patients in the development of study concepts, incorporating patient experience data from clinical trials, and more.
The Patient Advocate Foundation is a national organization. The core of what they do is direct services for patients with access and affordability challenges. So really helping, we serve about 150,000 patients a year across the United States. And these are all patients with, they have access and affordability challenges, and they have some sort of chronic or complex condition. So we serve patients in over 600 conditions. We've been doing this work for about 25 years. And over the course of doing this work, what we found is that we learned so much about the patient experience, patient preferences, things that patients are going through as part of their care, and also as kind of an extension of their care, right? Just in life. And so a few years ago, I think it's about 5 years ago now, I started at PAF to really develop an infrastructure to bring patient perspectives into policy, healthcare transformation, and health research spaces, right? Because we're learning all this from patients. We have patients that want to give back, they want to engage in projects, they want to share their expertise. And so we decided to build out that infrastructure to make sure that there was a diverse and representative group of patients that had experienced these challenges informing the work that is transforming the entire healthcare ecosystem. Part of the Patient Insight Institute, which is our research and engagement hub, we do work integrating patients and the patient perspective into clinical trial and other research projects. So kind of that engagement on the front end and the development, the methodology, the topics that are going to be covered and focused on, how do you do recruitment, all of that upfront engagement that's so important to making patient-centered projects in clinical research. The other piece of the puzzle is that patients often come to us searching for clinical research as a care option. And that is something that through our case management program that we can help patients with as well, help them navigate what clinical trials may be available for them if that's something that they come to us looking for. Yeah, we've actually done some surveys with our patient community in this very subject. One of the biggest barriers is that patients aren't being asked, right? They're just not being approached. And I think oftentimes clinical trials happen in very specific care settings, very specific clinics. And oftentimes those are larger clinics and systems, and our patients, because they have access and affordability challenges, very often they're seen in smaller community care settings or rural settings. And so I think the last time we surveyed, about 70% of our patients said that they hadn't even been approached to be part of a clinical trial, but they did say that they would consider it if they'd been asked. And particularly patients like being asked by their provider, right? Somebody they trust to get them into the trials. I think there's two different kind of approaches here. So there's this push to have clinical trial enrollment to be more diverse and representative. And for that, we really need to think about patients, not just recruiting them into trials, but also retaining them in trials and thinking about some of their needs, whether that's transportation, whether those are other social needs that are interfering with their ability to commit and be part of these trials, as well as how can we reach out to patients and get them enrolled, right? Get them knowing about what clinical trials are and what's available. One of the great solutions to that side is engaging them up front, like you mentioned. And that's really to ensure that clinical trials are not only focused on things that are most important to patients, but that those clinical trials are implemented in a way that are easy for patients to understand what they're doing, what the commitment is, making sure that those recruitment efforts are patient-centered, making sure that the educational materials, the consent materials, all those pieces patients are understanding, and that the burden isn't on patients once they get enrolled in the trial, because that's when you see patients really drop out of trials, when it's high burden and doesn't fit into their schedule or meet their needs. I think all clinical trials should have some sort of patient-centered outcomes associated with it, right? So this idea of a drug may work, a treatment may work, but if it's something that is not tolerated well by patients, if it's something that has limits around the accessibility to patients, it's not going to matter, because patients aren't going to be able to adhere to it. They're not going to be able to afford it. They're not going to want to take the medication or be part of the treatment. And so pulling those patient experience pieces, that patient data in from the very beginning, thinking about patient-centered outcomes, which go beyond a lot of the clinical outcomes, is going to make sure that you develop a treatment that not only works for patients, but it's something that patients are going to be able to adhere to and want to take. I mean, to be completely honest. Something that people aren't talking about, but I think really need to be addressed, is the importance of trusting patients in this process. A lot of times clinical trials are centralized because they need to control every aspect of that clinical trial experience and process. And I think we can give patients the benefit of the doubt that they can adhere to certain protocols. They can do things, whether it's a wearable or a device that's uploaded to the internet, their own blood pressures. So give patients the benefit of the doubt and trust that patients can and will do these pieces in a decentralized, patient-centered way, because they want to see the best outcomes for the trial as well. The second thing that I would recommend is really thinking about where patients are seeking care and trying to incorporate those clinics in steps of the clinical trial, right? So decentralized can mean like a hybrid, right? Something where the patient is doing it, but it can also mean where patients are, their point of care, they can also be doing steps that are related to the clinical trial, and not necessarily having to, go into that centralized site. Again, trusting those clinics or those points of care to be able to do those steps, training them well. And again, that reduces the burden on patients. And they're also in a space and in an environment with people that they trust, which is where, their primary care for providers or their regular doctors. And I think that would also enhance the trust for clinical trials in the communities. We keep talking about it in different ways. The good news is when we survey our patients, again, which are a fairly representative sample of those patients that have some sort of access or affordability challenge, we find that for the most part, they have devices. Those devices tend to be mobile, so you need to make things mobile friendly, which I feel like we're doing that more and more. The other piece of the puzzle is thinking about those areas, particularly rural areas, that may not have the bandwidth to do, to connect to the internet. There's a lot of areas that still have very limited Wi-Fi capabilities and or mobile data capabilities, and we really need to think about that lack of infrastructure in some of those areas. And I think the last piece is that people still are a bit picky with how and where they're going to spend their time and resources. And so most people have some sort of a data plan. We just have to make sure that it's something that they are willing to spend, if you will, on these trials. And in places that do require a lot of connectivity, thinking about how you can supplement or pay for that for patients, to help them, right? To help them get that connectivity, whether it's home Wi-Fi or mobile.